Assalamu alaikum. Bismillahirrahmanirrahim. The thought of the day is Wala talbisul haqqa bil ba'tili wa taktumul haqqa wa antum ta'lamun. And do not mix the truth with falsehood or conceal the truth while you know it. Assalamu alaikum. My name is Dr. Inshrah and I am a PGR of Community Medicine at King Edward Medical University, Lahore. Today, I'll be presenting the topic Global and National Action Plan for Prevention and Control of NCDs. And I'll be presenting it under kind supervision of Professor Dr. Saira Afzal. Our learning outline today will be Introduction, Global Action Plan, 9 voluntary targets of 2025 that were later extended to 2030, National Action Plan, recent updates, and then MCQs. Learning objectives. At the end of this presentation, the participants will be able to explain the Global Action Plan for NCDs and its key strategies, identify the 9 voluntary global NCD targets, and describe the significance of a national NCD action plan and its key components. Global Action Plan. The World Health Organization has developed a comprehensive strategy to combat non-communicable diseases through the Global Action Plan for the Prevention and Control of NCDs 2013 to 2030. This plan aims to reduce the global burden of NCDs, which include cardiovascular diseases, cancer, chronic respiratory diseases, and diabetes. To guide the implementation of this action plan, WHO has introduced the Implementation Roadmap 2023 to 2030. The Global NCD Combat 2020 to 2030 serves as a high-profile initiative to encourage member states to adopt best practices, policies, and programs aimed at improving NCD outcomes. Collectively, this underscores WHO's commitment to reducing premature mortality from NCDs by 1/3 by 2030 in alignment with the Sustainable Development Goals. There are 6 objectives of Global Action Plan. Objective 1 is to raise the priority according to the prevention and control of non-communicable diseases in global, regional, and national agendas and internationally agreed development goals through strengthened international cooperation and advocacy. Objective 2 is to strengthen national capacity, leadership governance, multi-sectoral action, and partnerships to accelerate country response for the prevention and control of non-communicable diseases. The third objective is to reduce the modifiable risk factors for non-communicable diseases and underlying social determinants through creation of health-promoting environments. Fourth objective is to strengthen and orient health systems to address the prevention and control of non-communicable diseases and the underlying social determinants through people-centered primary healthcare and universal health coverage. The next objective is to promote and support national capacity for high-quality research and development for the prevention and control of non-communicable diseases. And the sixth objective is to monitor the trends and determinants of non-communicable diseases and evaluate progress in their prevention and control. There are 7 overarching principles that include human right approach, equity-based approach, multi-sectoral action, life course approach, empowerment of people and communities, evidence-based strategies, and then universal health coverage. One by one, we will discuss all of these. So starting from human rights approach. It should be recognized that the employment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, color, sex, language, religion, political or other opinion, national or social origin, property, birth, or other status. Equity-based approach. It should be recognized that the unequal burden of non-communicable diseases is influenced by the social determinants of health. Action on these determinants, both for vulnerable groups and the entire population, is essential to reduce the overall burden of non-communicable diseases and create inclusive, equitable, economically productive, and healthy societies. Multi-sectoral action. It should be recognized that effective non-communicable disease prevention and control requires leadership, coordinated multi-stakeholder engagement, and multi-sectoral action for health, both at government level and at the level of a wide range of actors. Government approaches across sectors such as health, agriculture, communication, education, employment, energy, environment, finance, food, foreign affairs, housing, justice, and security. Life course approach. Opportunities to prevent and control non-communicable diseases occurs at multiple stages of life. Interventions in early life often offer the best chance for primary prevention. Policies, plans, and services for the prevention and control of non-communicable diseases need to take account of health and social needs at all stages of the life course, starting with maternal health, including preconception, antenatal and postnatal care, and maternal nutrition. Empowerment of people in communities. People in communities should be empowered and involved in activities for the prevention and control of non-communicable diseases, including advocacy, policy, planning, legislation, and service provision. Evidence-based strategies. Strategies and practices for the prevention and control of non-communicable diseases needs to be based on scientific evidence. Universal health coverage. All people should have access without discrimination to nationally determined sets of the needed promotive, preventive, curative, rehabilitative, and palliative basic health services to provide medicines and diagnoses which are essential, safe, and curative. Global NCD targets. Global NCD target for 2025. Set of 9 voluntary global targets for achievement by 2025 for the prevention and control of non-communicable diseases. The target related to a 25% relative reduction in overall mortality from cardiovascular diseases, cancer, diabetes, or chronic respiratory diseases concerns premature mortality from non-communicable diseases between ages 30 and 70. These are the 9 targets. A 10% relative reduction in prevalence of insufficient physical activity, at least a 10% relative reduction in the harmful use of alcohol, a 25% relative reduction in risk of premature mortality from CVDs, cancer, diabetes mellitus, or chronic respiratory diseases, a 25% relative reduction in the prevalence of raised BP or the contained prevalence of raised BP, a 30% relative reduction in prevalence of current tobacco use, a 30% relative reduction in mean population intake of salt or sodium, halt in rise of diabetes mellitus and obesity. At least 50% of eligible people receive drug therapy and counseling to prevent heart attacks and strokes. And then an 80% availability of the affordable basic technologies and essential medicines, including generics required to treat NCDs. As I have discussed earlier, that these global NCD targets were later extended to 2030. The 2030 version includes a one-third relative reduction in the overall mortality from cardiovascular disease, cancer, diabetes, or chronic respiratory diseases. A 20% relative reduction in the harmful use of alcohol. A 15% relative reduction in place of the earlier 10% reduction in prevalence of insufficient physical activity. A 30% relative reduction in mean population intake of salt or sodium, a 30% relative reduction in prevalence of current tobacco use, a 25% relative reduction in the prevalence of raised blood pressure or to contain the prevalence of raised blood pressure, halt in the rise of diabetes and obesity. At least 50% of the eligible people aged 40 years and older with a 10-year cardiovascular risk greater than 20%, including those with CVD, to receive drug therapy and counseling, including glycemic control to prevent heart attacks and strokes. And then the same as 80% availability of the affordable basic technologies and essential medicines, including generics, required to treat major NCDs in both public and private facilities. Moving forward to the National Action Plan for the Prevention and Control of Non-Communicable Diseases and Health Promotion in Pakistan. The National Action Plan has modeled on an integrated approach to the prevention and control of NCDs and health promotion. It delivers an integrated framework for action, which narrows down the broad agenda for the prevention of NCDs. This occurs through public-private partnership. The multidisciplinary nature of the approach to the prevention and control of NCDs warrants changes at the level of the individual, the community, The health system and the health policy maker. This diverse playing field is an ideal setting to approach through a private, public, international health agency partnership arrangement. Then integrated approach to NCDs. This includes disease domain integration. The term NCD is technically reserved for a group of preventable diseases that are linked by common risk factors. Cardiovascular diseases, some chronic lung conditions, cancers, and diabetes fall within this category. Action level integration. The paradigm of the non-communicable diseases prevention referred to above is multidisciplinary in nature. It calls for a diverse range of actions involving policy development, legislation, regulation, public and professional education, guideline development, media interventions, and research. Then there is system level integration. This approach adopts as a part of the National Action Plan horizontally integrates the NCD preventive agenda with existing public health, primary healthcare, and social welfare infrastructure. And then integration of concepts. These include a behavioral, research, and social marketing guided communication strategy, an active role for local opinion leaders and educational institutions, reorientation of health services to a more preventable orientation. Then there is evidence-based approach. This effort is an example of the incorporation of a core public health principle into a country health programmed planning through an approach that seeks evidence before planning interventions and utilizes intervention monitoring to generate further evidence. Then there is maximizing strength of the partnerships. This initiative also created a mechanism for visible involvement and participation of relative ministries, educational institutions, NGOs, and leaderships foci at a national consultation level and created avenues for this participation. Linkages with national health policy. A careful review of Pakistan's current health policy shows that this action plan is set within the existing policy framework. It focuses on the prevention and control of diseases that are both hazardous and largely preventable. Relationship with development agenda. Poverty eradication has assumed a centered stage position in the global development scenario. However, in addressing health issues within this framework, global attention remains focused on health-associated goals embodied in the Sustainable Development Goals. Unrealized ancillary benefits. This strategy outlined in this action plan has many ancillary benefits that have not been addressed directly. The action plan brings health benefits to all other age groups, assists with healthier lifestyle that are essential to reproductive health, enables a reinforcement of the nutritional strategy, and promotes prevention-related practices which have implications for disabilities such as cataract. Action plan, specific description and clarification. Activities originating in different parts of the health sector need to be synchronized for a concerted action aimed at reduction in disease-related mortality and morbidity. Priority settings. Priority setting is imperative for the rational utilization of resources for public health programs in a country. The combined approach matrix is used to assist with setting priorities. This approach is found to be a useful tool for organizing information. The common areas of action in integrated framework of action. The integrated framework for action encompasses two sets of strategies. The first strategy includes behavioral change communication, reorientation of health services, and monitoring and surveillance. The second pertains to legislative and regulatory matters. Behavioral communication. The aim of the community interventions as part of this action plan is to support the evolution of a set of cultural practices that get embedded as lifestyle habits within the population of Pakistan. The IFA focuses on modifying individual, group, and community behaviors through media and other community interventions and target individuals in appropriate settings. Then there is research. The action plan attempts to bridge the gap between academic researchers and policymakers and administrators engaged in planning evidence-based. strategies for bringing about an improvement in health outcomes. A necessary prerequisite for effective planning, implementation, and evaluation of NCD prevention programs is access to reliable and timely information on mortality, morbidity, risk factors, and other socioeconomic determinants. Reorientation of health services includes training of health professionals, then infrastructure at healthcare settings, and then drugs at basic healthcare levels. Common areas of action are primordial prevention, that is related to health promotion. This is particularly important in Pakistan's healthcare and cultural context, where community health intervention should logically be structured to draw support from the extensive network of healthcare providers at the grassroots level. Strong tripartite partnership between the Ministry of Health, WHO, and Hartwell has been set up to lead this action. Moving forward to the recent updates. Raising awareness around trends in non-communicable diseases and their risk factors to promote global prevention and control. According to WHO, NCDs arise from a combination of behavioral, metabolic, and environmental risk factors. Modifiable behaviors such as tobacco use, physical inactivity, unhealthy diets, and harmful alcohol consumption significantly elevates NCD risk. Metabolic risk factors, including high blood pressure, obesity, elevated blood glucose, and high blood lipids, drive NCD development. Environmental factors like air pollution further exacerbates NCD risk, causing 6.7 million deaths globally, with 5.7 million linked to conditions such as stroke, heart disease, chronic obstructive pulmonary disease, and lung cancer. Although these risk factors are considered modifiable, global efforts to minimize them remain abysmally low. A critical bottleneck in this sluggish response is the widespread lack of awareness or inadequate knowledge about non-communicable diseases and their associated risk factors among the general public and policymakers. This highlights the urgent need to prioritize raising awareness about NCDs and their risk factors. The role of community empowerment in efforts to prevent non-communicable diseases, literature review. Community empowerment through health promotion by providing education to increase knowledge has become a strategy to support the prevention and control of NCD independently by the community. Research results show that community empowerment has a positive impact, especially in increasing awareness, interest, and attention to the importance of health information. With growing awareness, communities are becoming more active in taking preventive measures, making this empowerment an important foundation in building healthier and more resilient communities. Multi-omics approaches for understanding gene-environment interaction in non-communicable diseases, technique, translation, and equity issues. This scoping review evaluates the global landscape of multi-omics data related to the NCDs from 2000 to 2024, focusing on recent advancements in multi-omics data integration, translational applications, and equity considerations. We highlight the need for standardized protocols, harmonized data sharing policies, and advanced approaches such as artificial intelligence or machine learning to integrate multi-omics data and study gene-environment interactions. We also explore challenges and opportunities in translating insights from gene-environment research into precision medicine strategies. We underscore the potential of global multi-omics research in advancing our understanding of NCDs and enhancing patient outcomes across diverse and underserved populations, emphasizing the need for equity and fairness-centered research and strategic investments to build local capacities in underrepresented populations and regions. Moving forward to the multiple choice questions. According to the Global Action Plan, all countries should implement a law ensuring that healthcare services are provided without discrimination based on race, gender, or social status. Which principle does this reflect? A. Human rights approach. B. Universal health coverage. C. Multi-sectoral action. D. Evidence-based strategy. Or E. Life course approach. The correct answer is alpha. A government formulates policies encompassing health, energy, and justice to establish a comprehensive framework for chronic disease prevention and control. Which strategic approach does this exemplify? A. Human rights approach. B. Universal health coverage. C. Multi-sectoral action. D. Evidence-based strategy. Or E. Life course approach. The correct answer is Charlie. A public health expert argues that preventing cardiovascular diseases should start as early as fetal development. They emphasize that poor maternal nutrition, childhood obesity, and adolescent smoking contributes to adult heart disease risk. What principle of global action plan does this perspective align with? A. Human rights approach. B. Universal health coverage. C. Multi-sectoral action. D. Evidence-based strategy. Or E. Life course approach. The correct answer is ETA. A health program launches a campaign to reduce tobacco use by increasing taxes on cigarettes, enforcing strict advertising bans, and providing free smoking cessation services. 1 year later, surveys shows a decline in the number of smokers. This initiative is most closely aligned with which global NCD target for 2025? A 30% relative reduction in prevalence of current tobacco use. B, a 10% relative reduction in prevalence of insufficient physical activity. C, an 80% availability of essential medicines to treat NCDs. D, a 30% relative reduction in mean population intake of salt or sodium. E, a 25% relative reduction in prevalence of raised blood pressure. The correct answer is alpha. A country's Ministry of Health implements a policy requiring all public and private healthcare facilities to stock affordable essential medicines for non-communicable diseases, including insulin, antihypertensives, and statins. Which global NCD target for 2030 does this policy addresses? A 25% relative reduction in prevalence of raised blood pressure. B, an 80% availability of the affordable basic technologies and essential medicines. C, a 30% relative reduction in prevalence of current tobacco use. D, a one-third relative reduction in overall mortality from NCDs. Or E, the halt in rise in diabetes and obesity. Correct answer is beta. A 35 years old software engineer has a sedentary lifestyle with minimal physical activity. A nationwide initiative introduces workplace fitness programs, subsidized gym membership, and awareness campaigns to encourage regular exercise. This intervention supports which global NCD target for 2030? A. Halt in rise in diabetes and obesity. B. A 30% relative reduction in mean population intake of salt or sodium. C. A 20% relative reduction in the harmful use of alcohol. D. A 15% relative reduction in prevalence of insufficient physical activity. E. A 25% relative reduction in prevalence of raised blood pressure. Correct answer is delta. A country is launching an initiative to strengthen the fight against non-communicable diseases. The plan involves engaging ministries, educational institutions, NGOs, and leadership's foci at a national consultation level. This collaborative approach aligns with which principle of public health intervention? A. Health system decentralization. B. Maximizing strengths of partnership. C. Universal health coverage expansion. D. Community-based disease surveillance. Or E. One health approach. Correct answer is beta. An initiative in Pakistan aims to integrate healthy lifestyle practices into daily routines by using community-driven interventions. Which of the following is the most effective approach to achieving long-term behavioral change? A. Conducting a single health awareness seminar. B. Implementing strict legal regulations without public education. C. Using digital and traditional media for continuous engagement. D. Providing short-term financial incentives for behavioral change. Or E. Relying only on an individual motivation without external support. The correct answer is Charlie. In the prevention of NCDs, many health professionals suggest a healthier lifestyle, and this is also beneficial for health reproductive system. Which type of benefit depicts in this statement? A, co-benefit, B, cost benefit, C, medical benefit, D, disability benefit, or E, ancillary benefit. The correct answer is ETA. Dr. Aisha, a public health researcher, finds that policymakers struggle to implement evidence-based NCD prevention programs due to a lack of coordination with researchers. An action plan is introduced to bridge this gap. What is the most critical factor for effective planning, implementation, and evaluation of these programs? A, increasing funding for healthcare infrastructure without focusing on data collection. B, implementing policies based on general assumptions rather than research evidence. C, ensuring reliable and timely access to mortality, morbidity, risk factors, and social economic determinants. D, prioritizing short-term solutions over long-term strategies for NCD preventions. Or E, rely solely on qualitative studies without incorporating statistical data. Correct answer is Charlie. This is the key to all MCQs. This is the link of our YouTube channel where this presentation will be uploaded. Thank you for your attention.